Hello and welcome to SW News. This is me, Aarti. Now, India is under a continuous lockdown till May 3rd, and this is the extended lockdown that was extended by Prime Minister Narendra Modi after 14th of April. Now, to fight the battle against COVID-19, the lockdown is very much important, and this is the 8th day of the extended lockdown by Prime Minister Narendra Modi. And in this duration, we at SW News are bringing you this special video series of COVID-19 updates where we summarize the entire day's news related to coronavirus in brief for you. So let's begin with the global cases of coronavirus and the death toll. Globally, coronavirus cases have reached up to 25,79,894 and 1,79,059 people have died. In India, as of now, there are a total of 20,471 active cases of coronavirus. 3,960 people have either been cured, discharged or migrated, and 652 people have died due to coronavirus. There were 53 deaths reported on Tuesday. This is the largest number of deaths in a single day in India. There have been 19 deaths in Maharashtra and Gujarat. 4 people died in Madhya Pradesh. Similarly, 3 people died in Uttar Pradesh and West Bengal. 2 patients died in Andhra Pradesh. 1 patient each died in Rajasthan, Tamil Nadu and Karnataka. So far, 10 people have lost their lives on Wednesday. 5 died in Gujarat, 2 each in Maharashtra and Andhra Pradesh. A death also was reported from Aligarh in Uttar Pradesh. Let's begin with the first important news of the day. The first important news, of course, today is that the central government has passed the Epidemic Disease Amendments Ordinance 2020. Now, why was this ordinance important? Because the healthcare professionals, the frontline workers who are at the front line of this battle against coronavirus had complained to the Home Ministry, had complained to Home Minister Amit Shah and requested Prime Minister Narendra Modi as well. They were protesting against the constant attacks on the doctors, on the nurses and the healthcare professionals. Now, you might remember since the COVID-19 outbreak began, the doctors and nurses and the frontline workers, even ASHA workers, Anganwadi workers are going door to door and conducting surveys. However, some doctors across the country, some teams of doctors in various parts of the countries are facing a huge problem where locals are attacking them. Now, one particular such incident came out in Indore, a video of which went viral also, in which we could see that locals were pelting stones at the doctors. They were holding sticks and they were trying to beat up the policemen. One such incident also came out in Uttar Pradesh, in Moradabad as well, where a doctor was seriously injured. In Bangalore also such case happened, and in many parts of the country attacks on doctors were reported. Now, not only when they go out in the local areas to check upon the coronavirus patients, coronavirus suspect, this happened, but also inside the hospitals also some incidents happened where some incidents were reported where some patients spit at the doctors, putting their lives in danger. Now, to prevent all of this, to prevent our healthcare workers, today the central government passed this ordinance and made the act of attacking the healthcare professionals, of injuring the healthcare professionals, a non-bailable offence, and it could be punishable with a jail term and fine as well. Now, if they attack the healthcare professionals, then there can be a jail term that can range between 3 months to up to 5 years, and the fine can range from rupees 50,000 to rupees 2 lakh. However, in case the doctors, the healthcare professionals incur a very serious injury, a very severe injury, then the amount of fine can also be increased, and the number of punishment years, the jail term can also be increased. The jail term in this particular case, where the healthcare professionals are severely injured, it can range between 1 year to 7 years, and in case of healthcare professional severely injured, the fine can extended from 1 lakh to 5 lakhs. So these are the provisions under which the doctors are being protected. Prime Minister Narendra Modi, Home Minister Amit Shah, after passing this ordinance, tweeted about this, and they said that their government is committed towards protecting the doctors. And IMA also, after the assurance, after the act, they also rolled back their protest. Let's move on to next important news. Prime Minister Narendra Modi will converse with state chief ministers on April 27th through video conferencing. Now let me remind you that the lockdown in the country has been extended till May 3rd, and when the last time Prime Minister Narendra Modi spoke to the entire nation, he addressed the entire nation. He said that some areas, some districts and some states will be identified, and in these areas, if people follow the lockdown strictly and if people in the area, in the locality adhere to the guidelines issued by the center, then there will be some relaxation, some economic activities in those areas will be started again, but there will be a condition of social distancing. And the central government apparently started the economic activities again as well. From 20th of April, there were some relaxation. However, some states refused to implement those relaxation owing to the high numbers of coronavirus patients and deaths in their particular state. Delhi was among them, Punjab was among them. Telangana also decided to extend the lockdown till May 7th. Now, to take the stock of the entire situation and what is happening in every state regarding the coronavirus, Prime Minister Narendra Modi will be taking this meeting, will be conducting this meeting with chief ministers on April 27th. Let's move on to next important news. The coronavirus cases in India are continuously rising. As we told you that 20,000 plus are the number of coronavirus cases in India currently, and the death toll has also increased past 600 mark. Now, more districts in India are infected with coronavirus. There have been cases of coronavirus being reported from more number of districts than previously, and apparently 6 cities amount to 45% of India's total coronavirus cases. 45% is a huge number. Mumbai obviously tops that list. After that, there is Delhi, then there is Pune, Indore and Jaipur. These are some of the cities which amount together amount to 45% of the total coronavirus cases in India. Now, I am going to list you all the cities and the number of coronavirus cases in those particular cities. Apparently, the coronavirus cases have been reported from 430 districts till Wednesday, up from 211 on April 2. The government data has shown there are 6 major cities which have registered over 500 cases till now, accounting for about 45% of the total cases across the country. Mumbai tops the chart with over 3,000 cases, followed by Delhi, which stands at 2081, Ahmedabad at 1298 and Indore at 915, Pune at 660 and Jaipur at 537. Let's move on to next important news. The central government had constituted some teams to observe the COVID-19 hotspot in the country. They had constituted these interministerial central teams which were asked to go around the country and check the coronavirus hotspot and assess whether the lockdown is being followed in the coronavirus hotspot or not. Now, one such team was also arrived in Mumbai, and the team particularly went to the coronavirus hotspot in Mumbai. One of them was Varli Koliwada and another of the hotspot is Dharavi. Now, the team visited 2 of the hotspot. However, they praised the way lockdown was implemented in Varli Koliwada. The central team also praised the Varli Koliwada model, and they said that this could be an ideal model for the entire country. They praised the way the lockdown was strictly being followed in the area. Now, let me remind you that Varli Koliwada is a dense population. There is a slum, and this Varli Koliwada emerged as coronavirus hotspot in the BMC's G South ward. However, the central team has praised the way the lockdown has been implemented in Varli and the way coronavirus cases were controlled in the area. However, they also visited Dharavi, and now they are also assessing what is the situation in Dharavi. However, they have also warned that there will be some increase in cases in Mumbai, and they have also asked to prepare more beds and to prepare, they have also asked the hospitals to be prepared with more number of beds and oxygen supply. That's all for the coronavirus update today. For more news and update, you can log on to www.hwnews.in.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, subscribe to our YouTube channel.